Chairman, and let me thank the ranking member also. The World Health Organization, says that there are 1 billion people who suffer from brain-related diseases or disorders. In America, the National Institutes of Health says over 100 million Americans have some form of brain-related disease or disorder. These range from Alzheimer's, autism, bipolar disorder, mental health challenges, schizophrenia, depression, migraines, traumatic brain injuries. I have been focused on this issue for a number of years. I launched the Fattah Neuroscience Initiative. We've had many successes. We created a first ever high priority research effort at the federal level, an interagency working group that's now issued its report around these challenges. Last year, we, in the spending bill, directed the White House Office of Science and Technology to partner with the pharmaceutical industry. And we just seen now the NIH announced this accelerated pharmaceutical partnership focused in part at Alzheimer's and some other diseases. And most recently, in the omnibus bill passed by the President, I included language that would internationalize our effort. And it's now become public that I've been asked, and I'm working now on a draft agreement between the EU, which has $1.5 billion initiative to map the human brain, and our own brain initiative here. Along with the Israelis, there are a lot of international efforts around brain research, and we want to see if we can work together to understand some of the mystery that still surrounds how the brain works, how a healthy brain works, and therefore hopefully lead to treatments and cures for some of the challenges in our own nation. We have almost 5 million Americans suffering from Alzheimer's alone. And what this means to this committee, the Budget Committee, is not just the suffering of those families, but I would quote former Speaker Gingrich in 2011 when he cited the rising economic toll of Alzheimer's. In a speech to the Brookings Institution, he said, "Helping with Alzheimer's alone could be a revolutionary reduction in costs for America. We currently spend $183 billion." And that was in 2011. We last year spent $208 billion on Alzheimer's care. But he goes on to say to treat Alzheimer's, and the disease is currently projected to cost the federal government $20 trillion, a number equal to one and a half of federal debts between now and 2050. Speaker Gingrich goes on to say slowing Alzheimer's onset by 5 years would save half of that projected cost, $10 trillion. Even today's limited breakthroughs in Alzheimer's medicine have had a big impact. Only 1% of the patients who use Alzheimer's medications are in nursing homes 2 years after severe onset, as compared with 16 of those who do not use the medicine. And half the patients in our nation's nursing homes suffer from Alzheimer's. This is one of 500 diseases of the brain or disorders of the brain. So we have a lot of work to do. The Milken's Institute estimates in 2007 that mental illness accounted for $171 billion in lost economic output. The economic cost of traumatic brain injuries are approximately $76 billion annually. And we have about 2 million cases, particularly young people, not always young people, but who have some form of accident or circumstance in which they suffer a traumatic brain injury. You mentioned earlier, Mr. Chairman, Fort Hood, 40% of our soldiers who've been injured have a traumatic brain injury and make up a significant part of the challenges facing the VA. The economic cost of autism is about estimated to be $35 billion a year. Now, I'm talking in terms of dollars. This is the Budget Committee, but I know you share with me the fact that these are really human costs for the families involved, and it's something that we need to deal with as a country. Our country needs to do more in this area. We need not only prioritize increased investments here at home, we also need to work towards internationalizing our efforts on neuroscience. That's my view, is that we need to move towards working together with other nations, and that's something that I'm working on. I think that it makes sense for us to, even though we have the best researchers in the world, that the mysteries of the brain require, I think, an all-in effort, and that's why I pushed in this direction. Finally, I'd like to make one last point. As I come here this morning to present facts and figures, but also to offer a way forward. I've introduced, along with Congressman Fitzpatrick, a bipartisan bill that would take corporate settlements of wrongdoings, fines that are not specified for restitution, and put a third of those dollars into medical research and innovation. And the America Focus Act is a way to take dollars that are not taxpayers' money, dollars that we don't expect or know that are coming in, but come in as a result of litigation in which wrongdoing has been determined in many instances, and to take those dollars and help supplement the dearth of investments we're now making, in the NIH, where we're funding about 1 out of every 7 of the merit-based investigations that could lead to a cure in this regard. And also, Congressman Chris Smith and I will be announcing later on this week a major bill that we've introduced related specifically to Alzheimer's. So I want to thank the committee for its time, and I hope that you would make investments in neuroscience and brain-related diseases and disorders as a priority of the budget as you go forward. I believe it's critically important to our nation. Thank you.
Thank you, Congressman, for your testimony. Thank you for your concern, your compassion, your bipartisanship on this issue. And thank you for being here today. You're next.
I want to commend you for following the traditions of Philadelphia. The head of the first president of the American Psychiatric Association was a guy named Benjamin Rush, who was a signer of the Declaration of Independence, was the first psychiatrist. He came from Philadelphia, and the problems that you're talking about today, many of them go back a long way, but it's important that somebody keep pushing and bringing it to people's attention, so thanks for doing it.
Well, thank you. And the chairman and I, the Rangers are going to meet the Phillies to open up the baseball season. So one of us are probably going to have. But it's a pleasure to be in this room. My predecessor, Chairman Bill Gray, chaired the Budget Committee, and it's just an honor to be in the room and to see his portrait. Thank you for your time.
You do have Cliff Lee.